Hello everyone, I am Dr. Dipak Agarwal, Consultant Critical Care at Narayana Superspeciality Hospital. With me are the two stalwart and the masters of nephrology, Dr. Bismay Kumar and Dr. Tanima Das Bhattacharya. As today is 9th March and we are celebrating the World Kidney Day, this time the theme is Kidney Health for All, preparing for the unexpected and supporting the vulnerable. So before going into a proper questionnaire on the kidneys, I'd just like my doctors to throw some light on why exactly they came out with the theme of preparing for the unexpected.
Very warm welcome to all of you on this World Kidney Day occasion. This is a message to everyone regarding kidney awareness. Normally World Kidney Day we celebrate on second Thursday of every month, and the purpose of this is awareness and to make people understand the importance of kidney problems, and we have to save the future generation from having different complications of kidney problems. Now today what Dr. Deepak asked me is whether this theme, how relevant is this theme. Now friends, every year 2 lakh patients enter our OPD with end-stage renal disease. End-stage renal disease means that disease which cannot be reversed, a renal failure which can just end up in dialysis or renal transplant. Secondly, if you take the general population, 10% of human race on this earth is suffering with some kind of kidney problems. So you can imagine the population of 10% till the population of 2 lakh who is ending with end-stage renal disease, and there is a lot of things which we can do between this period. Now what exactly happened 2 years back was the COVID pandemic, and are we prepared for COVID pandemic? We were not prepared for COVID pandemic. So it was a sudden jolt to the entire health structure during this period which we faced, and we lost lots of lives, and in fact lots of patients with renal problems also perished during this period. So this was an unexpected period where we faced problems. We couldn't provide proper health care to even the normal patients, and because of this COVID issues we lost lot of non-COVID lives. So this is the reason this year the theme has come up to how can we protect our vulnerable population and how can we prepare for this unexpected. Unexpected can be any calamities. COVID taught us lot of lessons. Probably this is another eye opener which we have to see the future.
Thank you, sir. Ma'am, can you throw some light on the latter part of the theme, supporting the vulnerable?
Yes. As you know, that World Kidney Day is an awareness campaign, and kidney health for all, preparing for the unexpected and supporting the vulnerables. The second part of the theme is supporting the vulnerables. So who are the vulnerables? As we all know, these are the extremes of age, pregnant women, that is our senior citizens or the elderly population who have multiple comorbidities. That is, they can have cardiac diseases, they can be suffering from cancers, or they might be diabetic. These patients have associated renal problems which need to be taken care of. And even our pediatric population. We have seen even during the pandemics or during any viral illnesses, the kidneys also need to be looked into. The pregnant ladies or the immunosuppressed individuals who are on chemotherapy or on other immunosuppression drugs, these patients or these population should all be considered as susceptible, and each and every individualized treatment is necessary.
Okay, ma'am. Ma'am, I would like to continue with you. When we talk about kidney, what is exactly the function of kidney and why it is so important for us?
Yes, actually that is a very good question. Kidneys, most of us have an idea that it is only a filtering part of a filtering organ in our body. But kidney has basically 3 functions. It is excretory function, where it removes the waste products and the excess water from the body. Number 2 is the metabolic part, that is, it takes care of the acid-base balance or the pH of our blood, and also some other nutrients and electrolytes like sodium, potassium, calcium, magnesium, etc. And another very important part is the endocrine function, that is, kidney synthesizes hormones.
Okay.
Number one is erythropoietin. Erythropoietin is necessary for stimulating the red blood cell production. That is, the patients of kidney diseases, they can become anemic because of this lack of erythropoietin and the lack of the endocrine function of the kidney. Another thing is the bone health, that is calcitriol, or what we say is the vitamin D, active vitamin D. The kidneys are responsible for maintaining the balance between calcium, phosphorus, parathyroid hormones and vitamin D. And another part is the renin, that is, it is very important, this hormone is very important for maintaining blood pressure. These are the basically the functions of the kidney in a nutshell.
Okay, ma'am. Sir, can you just tell me why should we worry about the kidney and how does it impact our daily life?
See, basically kidney, as madam has already told, has lot of function which we have just heard. Now just imagine if any of these functions get deteriorates in your life, then you will have all those symptoms which is related to that function. If your urine output is reduced, your waste material, the body removes, the kidney removes urea, creatine and lots of waste material which is not necessary, which is poisonous for the body. And if those are not removed, then what is going to happen? You will have all those symptoms related to high urea and creatine called as uremia. You will have failure to thrive, difficulty eating, loss of appetite. If your hemoglobins are low, then you will have you will have less ability to work, you will have breathlessness, at night, difficulty in sleeping, difficulty working, concentrating on work. If you have if your proteins are less in your body and the proteins get excreted through urine, which is the normal function of the kidney is to protect the protein in the body, and it loses in the urine, then your proteins are going to come down, then you will have swelling in the leg, you will have facial swelling in the early morning, you will have frothing in the urine, you will have high blood pressure, you can have increased number of times you go to urine at night, and that will cause lack of sleep. Then you will have difficulty in concentrating in the daytime. Then all these things will ultimately reduce the quality of life, and once the quality of life keeps on reducing, you will have difficulty at your workplace, your employments will get disturbed, your medications list will keep on increasing. So that is how it affects not even the quality of the patient's life, it also affects the quality of the employer's life, because that causes difficulty in their families also. So if you see, it's a bigger problem, just not in the kidney, it is beyond the kidney, the complications which we are seeing all around when the kidney starts failing.
Okay, sir. So very well said about the functions, the importance of kidney and how to maintain the kidney function. Ma'am, can you just elaborate about the signs and symptoms of kidney disease and a bit about its complications?
Yes, actually kidney diseases are very subtle. The symptoms are extremely common symptoms which can be mistaken for simple acidity or simple indigestion. So initially, if I tell you that the early signs and symptoms of kidney disease, we can just say that it is early means E for edema, that is there is feet swelling or swelling around the eyes, or E for electrolyte imbalance, that is somebody is having a very low sodium or a very high potassium. These are also the symptoms of kidney disease. A is for say anemia as well as anorexia. Anemia, we all know hemoglobin levels are down, which are not being corrected by simple measures. So look for a kidney disease. Anorexia, that is if you are having a loss of appetite, that is a symptom of kidney disease. Or if you are repeatedly requiring an increase in your antihypertensive medications, which was earlier controlled with say one drug, then you must suspect underlying kidney disease. If you are having recurrent hypoglycemia, that is the diabetic patients having recurrent hypoglycemia, one should suspect an underlying high creatinine or a kidney disease. If there is recurrent nausea or vomiting, that is while brushing one's teeth, if somebody is nauseated, then think about kidney disease. If you are lethargic, that is you are feeling tired all throughout the day, think of the kidneys and they need to be checked. If you are not sleeping at night, that is you are yawning in the morning for a while of early, then or you might be having nocturia, that is you are going to the washroom at night several times of the day, then these are all very subtle signs and symptoms of your kidney disease. You are having foamy urine, that is the passage of protein in urine, as Dr. Bismay was saying. These are the initial signs and symptoms. But what happens if it is unregulated, if it is untreated? Then the patient can land up in emergency with any of neurological emergency or cardiac emergency. For example, the patients can have seizures or convulsions, they can have loss of consciousness, they can have cardiac emergencies like arrhythmias or even heart attacks, or they can have shortness of breath, recurrent vomiting which is uncorrectable with medications, or they are having generalized edema of the whole body, they are severely anemic. These are the basic few clinical symptoms and signs which we can understand that the patient is going into severe form of kidney disease and might require some therapy and some specialized care.
Okay, ma'am. As ma'am has talked about the signs and symptoms, can you just elaborate about the individuals who are more prone for this kidney diseases?
In fact, all individuals are prone for kidney diseases. In fact, nobody is immune. But yes, there are certain population which we have to specifically look for. If your parents are having diabetes, if you have genetic disorders of kidney diseases, there is a likelihood that you may also get a kidney problem. So keep your kidneys checked yearly wise. If you have diabetes, especially diabetes more than 5 to 8 years, then you can have kidney diseases, whether it's type 1, whether it's type 2. If you are having hypertension, especially young patients with hypertension, it's a red flag sign to check for kidney problems, because hypertension is one of the commonest cause or maybe the cause effect in younger population with kidney problems. And problem is, young population there is no symptom at all. That is why it is called as a silent killer. So you patients will have no symptom and suddenly they will come with high creatinine, end stage renal failure, and they will fail to understand why did they get this problem, because there was a hypertension which was not checked with kidney problem and there they missed the bus. Thirdly, pregnant ladies, especially pregnancy with hypertension, they are prone for kidney problem. Even pregnant ladies with pre-existing kidney problems can have worsening in kidney problems during their partum and the postpartum period. Then elderly population, there is a specific elderly population especially with prostate issues, ladies with urinary issues with recurrent urinary tract infections. Population more than 60 years, every 10 years after age of 45, the normal decline by age is 10% in your kidney function. So even by aging process, it's a life is, it's not stagnated, we all age, we'll all age one day. So once we age, organs will also age. So kidney also ages. So every 10 years there is a 10% decline in kidney problem if you are aging. And patients who are taking multiple painkillers, especially taking medicines over the counter, especially taking medicines of different natures, especially taking medicine without taking a doctor's consultation, those patients are high prone for kidney disease, especially painkillers, NSAIDs. These group of patients can have kidney failures. Patients who have renal stones, patients who have urinary problems, patients who work in a very stressful environment, especially daily wagers who are sweating but not hydrating properly, patients or people who are on high protein diet, lifestyle disorders, smoking. So if you see, you will have every individual, some amount of risk factors are there. So there are people who are on a higher risk range, there are people on a moderate risk range. So these all populations are at risk of kidney failures.
Okay. So I'll continue with you only. So as you talked about the risk factors, so what are the tests a patient who has an individual who is at high risk of developing kidney disease, so what all tests he can go for? And second is, once the kidney disease has been seen in a patient, what all tests he should go to confirm the diagnosis?
There are three basic tests which can be done. One is from the blood, second is through the urine, and third is a imaging test. First, I'll start with the urine, because that is where the first symptom, the early kidney failures can be detected. Looking for proteins in urine. That is the first stage where the patient starts a kidney problem. So, looking for proteins in urine, checking for urine microalbuminuria levels, these are the tests which can detect kidney at a very early stage. Then the blood test, where we use serum creatinine to calculate the glomerular filtration rate, the GFR. GFR is basically a calculation of how much of blood is cleaned by the kidney per unit time. So, that is measured by weight, the gender and the creatinine value. So, if you check creatinine, you can calculate the GFR. Third, and ultrasonography. Ultrasonography can detect structural kidney problems like stones, like stricture, like any hydronephrosis, any cyst. All these things can be not diagnosed with blood and urine, can be diagnosed with ultrasound. So, if you see, this basic test is available everywhere. It is a very cost effective. You can do it in a regular basis, and it can be done on all those vulnerable population in a proper way. In every yearly format, it can be checked.
Ma'am, can you just elaborate upon what are the basics of management of kidney disease and what are the treatment options they have?
Yes. Kidney disease, as we all know, that in the GFR wise there is a gradation of kidney disease. So, once the CKD or the chronic kidney disease goes into CKD 5, that is less than 15 ml per minute GFR, then the specialized treatment which is provided by the nephrologist is needed. But one must be aware that prior to reaching that stage, most of the patients are being treated by internists or our local doctors, and everybody should be aware that when the patient needs to be referred to a specialized nephrologist, that is when the patient's GFR is going down on an yearly basis, or when the patient is having symptoms which are not correctable, then the patient needs to be referred. So, basically the kidney disease management has been divided into conservative kidney management and the definitive or the other therapies which are available. In the conservative kidney management, we consider the lifestyle modification as in any other disease, that is get a healthy diet, maintain a proper body weight, maintain your blood pressure, maintain your sugar levels. If there are multiple comorbidities, that is if there is any cardiac disease or the patient is on several other medications, then the creatinine needs to be checked at a periodic interval, and it should be, they are taking several drugs which might have some interaction. In those cases, the creatinine level needs to be monitored along with the other investigations which Dr. Bismay was talking about. So, one of the most important tenet of conservative kidney management is definitely nutrition, that is diet. Dietitian is necessary, a dietitian consultation or consultation with a nephrologist who will inform you that what needs to be taken and what does not need to be taken to keep your kidneys healthy. So, the conservative kidney management, once it is not controlling your disease, then what we can do is we can provide dialysis for the patient, which can be in the form of hemodialysis or peritoneal dialysis, as we all know, and the best therapy or the renal replacement therapy which is of choice is actually renal transplant, because as earlier I was talking about the excretory, metabolic and the endocrine functions, the dialysis part takes care of the excretory and partly the metabolic functions of the kidney. But the endocrine functions, we have to supplement it with several injections or medications. But once the patient goes into transplant, this whole gamut of functions of the kidney are taken over by the transplanted kidney. So, this is just in a nutshell about the kidneys, but one must be assured that this kidney disease does not always mean dialysis. There is a large part of one's life of where without dialysis we can manage the patient for a long time and for several years. So, kidney disease does not mean end of life, it does not mean only dialysis or you have to go for transplant.
Okay.
Thank you.
Thank you, Dr. Tanima, Dr. Kumar, for your valuable input. So, in a gist, if you need to sum up, a healthy lifestyle which includes proper workout, healthy eating, adequate sleep, adequate intake of water is the key to a healthy kidney. Sir, would you like to give a take-home message for everyone?
Yeah, see, everything has a dark and a bright side of it. This disease, if you see, has a dark side. As I've just mentioned in the first part of my talk, that around 2 lakh population are ending up in renal failure, and actually in 80 to 90% of the patients we are not able to save them because we don't have proper infrastructure, because the affordability issues are there. But the bright side is these are preventable diseases. You can prevent them. Once these diseases start, it is very difficult to contain or reduce it. It will just progress. So there are basic things which you have to keep in mind. We have all discussed lifestyle, good blood pressure control, good sugar control, checking the vulnerable on a periodic basis, and most important thing is checking those patients, because see, if you spend, you can spend money on gold, you can spend money on festivals, you can spend money elsewhere, but when you have any problem, please don't go and just buy medicines on the off the counters. Please consult a consultation with a proper physician. Take the advice of a physician and then take medicine. Just don't go to any counter and just take medicine, but that can harm your kidneys. And second part of this theme is for all those policy makers. Probably this is an eye opener which we faced in last 2 years, that how you are going to do this if you face this problem again, if the COVID comes back in a different way or may have some other disaster, how we are going to protect our dialysis patient, how we are going to protect our CKD patient. Probably we have to make good policies to save them, to keep them protected, so that these things which we have just faced in our past should not recur.
Okay. Thank you.